Good afternoon, Mr. Chairman and committee members. Thank you very much for having me today to discuss the amendments to the excise tax, specifically around medical cannabis. I am here today because I fear for my rights as a medical cannabis patient and for all patients who choose cannabis. I have been actively involved in following the process of Bill C-45 and Bill C-46 to ensure the rights of medical cannabis patients aren't being forgotten. I have watched hours of committee meetings on Parleview and CPAC. I've hosted public discussions in Prince Edward Island. I have written letters to members of parliament, to senators, and I've met with local MLAs, MPs, and senators, and of course, patients. Despite my best efforts, I am still here fighting for safe and fair access to a treatment that I have been prescribed by my doctor. My goal in speaking with you today is to fill in some of the gaps in the general understanding of medical cannabis, to inform you of the obstacles medical cannabis patients face, and of how the additional excise tax will only further its inaccessibility. The myth that non-medical users will pursue their license to access medical cannabis to save $1 a gram is simply false. The ACMPR program is not convenient or a less expensive way to access cannabis, especially when retail stores will be a legal option. Medical patients are required to order their prescribed cannabis online, as it is not available in storefronts. The shipping costs vary on the licensed producer, but it ranges from $10 to $20 per shipment. Logically, it would make sense for patients to fill their prescription in one order to avoid multiple shipping costs per month. But many patients are living on one income or with financial assistance and have families to support. According to CFAM, 1 in 5 patients can't afford to fill their full prescription, let alone pay all of their prescription in one pay cycle. This statistic aligns with the anecdotal research that I've done through my advocacy work with patients across Canada. I'd like to take a moment to break down the costs associated with medical cannabis for you. A gram of cannabis can vary from $4 a gram to $17 when it comes in dry herb form. A typical prescription is 3 grams a day. We will say that on average, patients pay $10 a gram. What many people forget is that patients then have to consume their cannabis. Many doctors recommend that patients use vaporizers to eliminate certain health risks associated with combustion. A quality vaporizer will cost the patient no less than $75. The only alternative to inhaling cannabis currently available to patients is sublingual oils, which are on average $100 per bottle. Simply put, healthier options for medical cannabis patients are cost prohibitive. Medical cannabis is the only prescribed medicine subject to HST and GST. In addition to that, it is not covered by the generic drug plan, and there's only one insurance provider who will be offering limited coverage for specific diagnoses like cancer, HIV, and rheumatoid arthritis. This is a great start, but it's not enough. With the opioid epidemic wiping our country, I would be remiss not to mention the recent studies that have showed a decrease of opioid prescriptions in regions that have legalized non-medical cannabis. This in turn resulted in fewer deaths from opioid overdose. If I may, I would like to quickly share a story with you. A friend of mine, a young woman in her 30s, struggled with an addiction to opioids and benzos for 10 years of her life. She was recently diagnosed with MS just 2 years ago. With the help of cannabis, she has been able to stay away from opioids despite living every day in chronic pain. At a recent visit to the hospital for day surgery, she was offered opioids for the pain. She declined, explaining her past to the nurses. Not everyone in that situation would have been strong enough to say no. I believe that the current cost of medical cannabis and the costs associated with it, in addition to the excise tax, will not only drive medical cannabis patients out of the ACMPR program, but I believe it will drive them back to the black market or potentially to opioids. Despite the benefits of purchasing cannabis from a medical producer, for many Canadians, cost is the bottom line. Rather than taxing medical patients, I urge the government to please explore a different approach to taxing recreational users. We should be supporting those who have made the choice to use cannabis as a treatment as much as the patients who choose to use pharmaceuticals to medicate. Thank you very much for your time.
Thank you, Annie.